All right, I'm now here with Matthew Cunningham-Cook. He is a reporter for The Lever. Matthew, great to see you.
Thanks for having me on, Jen.
You've been covering at The Lever, among other things, the Biden administration's sort of quiet privatization of Medicare.
Yeah.
I wanted to talk to you about that. This has sort of been going on for quite some time, and I think that it has been rather underreported. So, maybe give us a sense of what this kind of privatization scheme looks like so far, and what do you think is behind this push from the Biden administration?
Yeah. So for a while, we've had Medicare Advantage, which
Yeah.
is stealth privatization, where the government pays Medicare Advantage insurers effectively higher rates than they pay for traditional Medicare, and lets insurers enter the market. But it's all voluntary, is Medicare Advantage, even though if some of the sales tactics are aggressive. Um, what we have now is what's called in its latest iteration ACO REACH, which is involuntarily assigning Medicares to a Medicare Advantage style plan. And this is a big get because basically any senior who talks to their regular doctor will typically advise against a Medicare Advantage plan if
Mhm.
the patient is a higher use patient. Uh, and so or is at risk of being a higher use patient. So that is a big disincentive for a lot of seniors and means that there's an effective cap on the amount of folks who will voluntarily sign up for Medicare Advantage. The advantage to the insurance industry and its private equity backers, and now Amazon, is that ACO REACH is a captive market that can be involuntarily assigned to a Medicare Advantage style plan. And the only way to get out of that plan is if you switch your primary care provider, which can be very difficult for anybody, but particularly difficult for senior citizens who are less sophisticated with technology, uh, less experienced in navigating the highly complex healthcare market in the US. So it's a really pernicious new development that really only benefits powerful industries like private equity and insurance. And we've been covering it at the Lever, and the reporting has gotten a lot of attention, I think, because very few other outlets are doing it, particularly with a zoom out perspective that places Medicare privatization as part of ongoing misconduct in the insurance industry and the aggressive private equity encroachment into all sectors of our economy. And now, on top of that, the aggressive encroachment of a fiercely anti union company, Amazon,
Mhm.
into this market as well.
So, what do you think is behind the Biden administration's turn in this direction?
Money, basically. And the insurance industry is very powerful.
Mhm.
They are large donors. The private equity industry is very powerful. They are large donors. We just saw on the Senate floor uh, a really aggressive amendment to the Inflation Reduction Act that uh, insulates private equity from effectively any new effects of this corporate minimum tax in the
Mhm.
Inflation Reduction Act. So they throw their weight around. They have a lot of influence. The former CIO of Carlisle is now the governor of Virginia. The former co-founder of Bain Capital is a senator from Utah, Mitt
Mhm.
Romney. Um, so they have deep relationships on Capitol Hill on both parties, with them being the largest donors, private equity and hedge funds being the largest donors to both parties as well. So it means that going against Medicare privatization at this point is not just about kind of going against, libertarian
Right.
bullshit ideology. It's going against the financial interests of some very powerful industries.
And, speaking of powerful industries, you had mentioned earlier that Amazon has been sort of getting into the Medicare privatization game as well. I know that you have an article for The Lever on that. So, what exactly has Amazon been doing in this realm? And what do you think this means for healthcare in the US?
Well, yeah, we just had a lucky break in March where I work with Suzanne Gordon at the Veterans Health Policy Institute, who's also a Jacobin contributor on veterans healthcare issues. And I was talking to her about ACO REACH, and she was like, I got involuntarily assigned into ACO REACH
Hmm.
by this company called One Medical. Um, and so we wrote about it, and that story was the first story that actually tracked a specific senior's experience with getting involuntarily assigned to an ACO REACH privatization plan. Uh, and then it turns out 5 months later that Amazon is buying that company, One
Mhm.
Medical, that
Mhm.
was initially backed by the Carlyle Group, which is a major private equity firm. And there's a lot of real dangers here.
Yeah.
So folks immediately raised the privacy angle. Yes, real concerns about privacy. Folks raised the monopoly angle of just Amazon reaching into all sectors of the economy. I, I would also add to it two additional components. The first is an issue we've been covering extensively at the Lever as well, is uh, Amazon's extreme and egregious violations of labor and occupational safety and health law.
Mhm.
So that's number one. So Amazon is now benefiting from Medicare privatization under an administration whose leader, Joe Biden, pledged explicitly on the 2020 campaign trail that federal contract dollars would not go to union busters.
Mhm.
So that's number one. Number two, is the broad is similar actually, is the broad market power of Amazon, the broad political influence of Amazon, where the founder and chairman owns the Washington Post, the second most read newspaper in the country, putting his weight behind Medicare privatization. Uh, this is, in some ways, you could say it's a Hail Mary for Amazon because its core profitability in its warehousing and consumer divisions is plummeting. They actually had their first loss in that sector in something like 50 quarters this most recent quarter. So Amazon is making a big play for Medicare privatization because it's a stable, captive source of revenue from seniors who have no way out.
Mhm. I want to now turn to a kind of, I guess, like broader question about Medicare in general. And, since the 1960s, obviously, Medicare has been kind of a bedrock entitlement in the US. And I think much like Social Security, it enjoys enough widespread support at this point that most politicians can't just come right out and say, we want to get rid of it, right? So instead, you see kind of what you've been talking about, which is these sort of
Mhm,
weird, like partial privatization schemes or like
mhm,
private public hybrids.
mhm.
You touched a little bit on this already, but how do you see just, this partial privatization affecting the program? And maybe just more broadly, like how do public private partnerships that so many Democrats seem to love, how well do they really work?
Yeah, I mean, to go back to Suzanne Gordon's work for Jacobin, where she and her husband Steve Early have been tracking the growth of privatization and the assault on the VA, which is
Mhm.
really the gold standard. I mean, the VA and the Indian Health Service, which in the latter case has a long history of horrible institutional racism, but those are the VA and the Indian Health Service are the only two fully comprehensive healthcare programs in the country where you have doctors and nurses directly employed by the government, and everything from the insurance to the care provision is in a one-stop shop model. And that's why the assault on the VA is so dangerous. It's the exact same thing for the privatization of Medicare. We
Mhm.
have a program that we know we need to expand, that expanding it will save countless lives. And so, what's the best way for an industry, for a whole plethora of industries threatened by expansion, to stop expansion from being politically viable? It's to undercut Medicare, it's to privatize it, it's to lower the quality of service so that the public get this silly idea of Medicare for all out of their heads. And this is exactly what Don Cohen has written about in his recent book, The Privatization of Everything.
Mhm.
It's exactly what we've seen from privatization for decades. Robert Poole, the Koch-backed strategist who developed and invented so much of the privatization language that we see today, he's been very explicit about this, about the goal of privatization being to undermine trust and confidence in the government and allow dividends to emerge to private capitalists. So what we're seeing is a really significant advancement of this
Mhm.
trend, and it's being ratified under a Democratic president with a Democratic Congress, and that is obviously not good.
Yeah. So let's jump forward to the recent news. Obviously, it looks like Joe Biden and the Democrats are about to get their spending bill across the finish line, and there are a few provisions in there that have to do with Medicare. I think one of the big ones is Medicare's ability to negotiate drug prices, right? So I think the final question for you is: does this reconciliation bill do you think that it fundamentally will alter the course that Democrats have been taking so far on Medicare?
No.
Short and sweet.
Yeah, I mean, I think that really what we need to be doing is strategizing for a plan to protect and save Medicare, and that is going up some very against some very powerful industries. And I think it's a testament, though, that Jacobin is a place where kind of these broader strategic questions can happen. And you've been publishing some interesting articles lately that I think go at this question of how exactly do we accomplish the types of changes in society that we need, not only to kind of build a socialist project on the one hand, but on the other, just protect what we have right now. And I appreciate that work you guys are doing. So
Thanks so much. All right, Matthew Cunningham-Cook again is a reporter with The Lever. You can also find his work in Jacobin, and we will link some of that below. Matthew, thanks again for your time.
thanks so much.
If you like this video from The Jacobin Show, please hit like and subscribe and share with your friends. Thanks.